I always like to let patients know that it's much more common than you would think. We think that about 20% of recognized pregnancies end in miscarriage, meaning that there are pregnancies that probably end in miscarriage or early pregnancy loss that we don't even know about. So it could be higher than 20%. Or another way to look at it is that about 1 in 4 people in their lifetime will experience a miscarriage. So when you think about all of those numbers, you probably know someone who's had a miscarriage, even if they haven't told you about it. An early miscarriage, I would say, is a miscarriage or an early pregnancy loss is another term that I'll use to describe it, that occurs in the first trimester. So any spontaneous loss of the pregnancy or a pregnancy that is not viable in the first trimester. I would say the most common cause of an early miscarriage is a genetic or chromosomal error in the pregnancy. And it tends to be sporadic, meaning that it's spontaneous. And the reason that I bring that up and the reason I tell patients about that is because it's unlikely to occur again. So it doesn't have to do with either parent's genetics. And if they choose to try again for pregnancy, they're likely to have a normal pregnancy. There's not a way to prevent these sporadic mutations or genetic problems, but because they are sporadic, I'm most confident that people will have a normal pregnancy the next time. So after a single miscarriage, we don't even initiate a workup because our confidence is so high that everything will be normal. Okay. That being said, there is some research that taking 81 milligrams of aspirin daily from when you're trying to conceive through the pregnancy can help increase your likelihood of having a live birth or a successful pregnancy. So I do talk to patients about that. It's not a requirement by any means, but if they're trying to reduce the risk of having another miscarriage, then they can take the 81 milligrams of aspirin daily. Of course, I always recommend taking a prenatal vitamin as well when they're trying to conceive. The most common symptom is bleeding, vaginal bleeding. It can be accompanied with cramping, but not always. But I think one of the most frustrating things about miscarriage or early pregnancy loss is that sometimes it doesn't come with any symptoms. So we may see someone in our clinic who's just coming in to verify their pregnancy and they're feeling normal. They may be having pregnancy symptoms, and we do that first ultrasound and we diagnose a miscarriage. And I think that can be it's always devastating, but I think that can be particularly hard because there were no warning signs that anything was going wrong. This is a hard question because these symptoms always cause anxiety, when you have symptoms, I should say. So bleeding and cramping in pregnancy are always going to cause patients to feel stressed. But light bleeding and spotting can be normal in pregnancy. I always encourage my patients, if they're not sure or they're concerned about symptoms, to call their provider if they have a provider. If that's me, obviously I tell them to reach out to me. But if they're having heavy bleeding or heavy cramping, I would absolutely recommend calling a provider if they have one. And if they don't have one, that's when I would encourage them to call our early pregnancy access center so we could assess their symptoms and hopefully see them within the next couple days to figure out what's going on. When someone's experiencing a miscarriage, there's 3 main treatment options. One is actually just to watch and wait, or it's called expectant management, meaning that there's about 80% of the time that the pregnancy will pass on its own. But that can take up to 8 weeks to happen. So not everybody is patient enough to wait for that, which is totally understandable. So we often will also talk about the 2 other treatment options, which is medical management or a procedural management of the miscarriage. For medical management, it's a combination of 2 medications. And then for the procedure, we do the procedures in our office, or we can also do them in the operating room so the patient doesn't have to be awake during the procedure. So from a physical standpoint, patients don't have to wait any time period to try to conceive again, assuming that they and their healthcare provider have deemed that the pregnancy is resolved. That means that they don't even necessarily need to wait for a period. Some people will wait for a period or a menstrual cycle just so they have some sense of where they are in their menstrual cycle. And then other patients may choose to wait just to have more time to heal emotionally from the miscarriage or the early pregnancy loss, and that's obviously totally reasonable and acceptable. But I always just like people to know from a physical standpoint, if they feel up for it, they can try right away.